It is a roadside wild plant called as Lantana camara, which is poisonous or toxic to animals as it contains triterpenes, which causes photosensitization in
Photosensitization in
wild animals
animals.
and liver damage. Plant parts like flower, leaf, and stem consist of triterpenes like lantana and lantana B. They got observed in liver and activated as toxic pyrols, which mainly damages DNA in hepatocytes by the process of alkalization and leads to cell damage, hepatomegaly, and hepatic cell death. Mainly three factors contribute to the photosensitization, that is presence of photoactive substance, exposure to UV light, and lack of skin pigment. The clinical symptoms of lantana poisoning is lesion appears at non-pigmented area, hairless areas such as nose, udder, skin, around the eye, muzzle, coronary band of hooves. Erythema develops rapidly, followed by edema. When exposure is prolonged, it leads to vesicle and bullae formation, which leads to serum exudation and ulceration. Lastly, skin necrosis and scab formation in the affected region. Along with erythema, animal shows photophobia. If photosensitivity is hepatogenous, ecteras is present. Some animals shows neurological signs due to accumulation of toxins in the brain. Postmortem findings mainly shows necrosis of the superficial unpigmented skin regions like around eyes, muzzle, ears. Liver may be enlarged and cirrhotic, and gallbladder may be distended. Diagnosis mainly depends on the clinical signs, history of exposure, and characteristic lesions. Infected animal blood has increased level of bilirubin and liver enzymes. The definitive diagnosis for photosensitization is increased level of porphyrin in blood. Prognosis for hepatic photosensitization is very poor compared to primary photosensitization. Treatment mainly involves palliative and supportive care. Corticosteroids should be given parenterally in early stages, and animals should be removed from photodynamic agents, and it will be kept in always shady places. Wound management is done properly to avoid maggot infestation and secondary bacterial infections by applying lotions and creams on the topical affected areas. Use of injections like antihistamines and unspecific anesthetics and antibiotic for secondary bacterial infections.